Yeah, so we just wanted to kind of show a little bit about our project first before diving into the piece on capacity development assistance in particular. So we have several cross-cutting approaches, which you can see on the left of this slide. We use systems thinking, and we have we've definitely have incorporated behavioral approaches, including for quality improvement and other kinds of things where maybe a behavioral approach is not quite as traditional. I think one of the most important things, is, of course, is that we engage country leaders as thought partners, part of the accompaniment approach. We're emphasizing catalytic innovations and learning agenda, and we have what we call 6 accelerators to action, which are on the right. Expanding partnerships, so working with both public-private partners, and private meaning faith-based organizations, private for-profit, non-for-profit organizations, co-creating and co-investing with them, looking at the technical rigor of our programs, focusing on equity gaps, also looking at technical and managerial capacity, which you'll hear more of, and lastly, on an adaptive management process. Next. And we are interested in this, again, in working with country partners. So we work at the global level as well and are really trying to work to elevate those voices from countries in the global architecture. So sort of flattening the hierarchy, so to speak. Next. These are the technical areas at the top, and you can see at the bottom the more cross-cutting areas of community health, local capacity development, et cetera. And these are the 13 countries we're currently working in, looking to expand as well. Next. So just maybe a little bit about some of those approaches other than capacity development as we get into that. So of course, as we know, we're not going to be reaching SDGs. Countries won't be unless they close equity gaps. Very important here. You can see on the right, the wealth quintiles, and you can see some of the large smear across wealth quintiles for the coverage for some of the most important high impact interventions. And of course, we know that M&H interventions unfortunately have some of the widest equity gaps. So trying to have some intentional approaches for closing those gaps is important. Next. We know how important it is for improving the life of a mother and making sure that the mother survives and thrives, because the rest of the family will also survive and thrive with a surviving and thriving mother. Next. This just gives you an idea of some of the technical materials that have already been produced in some accompanying projects and some that we are working with now to try with our partners to disseminate and use and learn from. Next. This again gives an idea of some, again, the technical rigor and trying to focus on those things that are the most important within the maternal realm. And the next slide. Same thing for a newborn in terms of focusing on the highest causes of mortality and those interventions that are the most important. So we're focusing on those, working with our partners to try to discover with them what are going to be the ways that we can help them best to increase effective coverage for those interventions. And so these are some of the fora in which we work with our partners, fora and communities of practice, to try to disseminate those lessons and learn together. Next. So we'll just get to, you can take the next slide. Now we can just get specifically to capacity development. And these are 3 lessons that we ourselves have learned from previous projects. They will not probably seem all that surprising to others about some of the particular barriers that we were trying to address in terms of capacity development, really putting local actors in the driver's seat, making sure that public and private institutions are working the most effectively together, and to make sure that those, especially those who are non-public institutions, are resourced enough and able to have some capacity to capture resources themselves. So I'll turn it over to Kavya, who can tell you about some of the approaches that we're using within the project.
Great. Thank you, Jim. And hi, everyone. It's a pleasure to be part of this networking session today. I am Kavya Ghai, and I am a Capacity Development Officer with PACT, which is a Momentum Consortium partner. So in terms of our approaches, capacity development is a core approach at PACT, and we define it as a continuous process that fosters the ability of individuals, organizations, systems, and communities to get stronger and achieve goals that they have set for themselves. Our theory of change states that if local organizations become strong internally, this then leads to improved external performance, which then leads to greater impact in their target communities. And then for each of these levels, we have several tools and approaches. And as Jim mentioned, we'll be focused on the ITOCA approach today, which is the Integrated Technical and Organizational Capacity Assessment, and how we're using that in Momentum with local partners. So looking at the purpose of the ITOCA, what is this exactly? So ITOCA is both a tool as well as a process that allows us to collaborate with partners to do a number of things. One of this is to identify their strengths, weaknesses, as well as capacity development needs. Second is to plan support that's needed by the partners in developing change action plans. And then third is both monitoring these plans as well as changes in the organizational capacity over time via reassessments. So overall, we start with the ITOCA baseline, which, as I mentioned, is a facilitated self-assessment that the partners go through. This then forms the basis for change action planning. And then the change action plan consists specifically of activities that the organization wants to do and how they plan to do them in order to meet their own capacity needs. And Momentum provides support to these partners, on the basis of what they have in their change action plans through a number of approaches, some of which are on the slide here. So this includes training, coaching, mentoring, consultancy services, peer exchanges, and so on, really sort of depending on what the partner identifies as what they need as external support. And once this change action plan process is done, we monitor these plans as well as do the annual reassessments to see if needs are being met and how we kind of need to adjust our plans as we go along. So the tool itself consists of several capacity areas, and these are divided into the organizational domains, which you see on the left-hand side of the slide, as well as several technical areas that Momentum Country and Global Leadership is focused on. And this includes the maternal and neonatal health area, which I'll get to in just a moment. So the tool itself, like I was saying, consists of several capacity areas, each of which have a number of indicators that correspond to 4 levels, which sort of represent a progression in the organization. So looking at the M&H area, we've developed an extensive set of indicators, 18 in total, which kind of range from measuring the types of goals and objectives the organization may or may not have set. Also looking at several standards of care, whether this be culturally appropriate care, quality of care, respectful maternity care, and so on. And then also looking at how organizations may be integrating within other services and how they kind of form learning collaboratives and other networks. So this sheet over here is a sample scoring sheet for the M&H area, just to give you an example around kind of how we facilitate this with the organizations. So this is kind of a screenshot of the tool. And if you look at, say, indicator number 4, which is the RMC indicator, how we've kind of arranged the 4 levels in a progression is, the first level is really kind of seeing if the organization is aware of these principles or not. And then as they progress, like a level 4 organization would, not only have this set of principles, but also have them aligned to kind of global standards, as well as have staff that are trained in these principles and kind of use them in their day-to-day functioning. So essentially, we have kind of these 4 progressive levels for each of these indicators. And as we do the ITOCA assessments, we are having sort of activities as well as facilitated discussions that, allow individuals to be able to kind of score and understand where their organization is in all of these indicators. And at the end of this process, we have a set of scores that are then sort of analyzed in our capacity solutions platform, and the results of this form a basis for discussion, which then informs the areas that the organizations need more support in and can include in their change action plans. So currently, we are using the ITOCA approach with several organizations in many countries in the Momentum project. And here specifically, I'm just focusing on 2 organizations that that are MNH groups and are using, MNH focused indicators. These are the Caribbean Regional Midwives Association, which is a professional associations of a number of professional associations in the Caribbean region. And then the second is the Sierra Leone Midwives Association. And again, for both of these organizations, because the ITOCA tool is really flexible and meant to be tailored to the organization's needs, we have sort of, taken up indicators that correspond better to professional organizations as well as their functions, and are using those in the tool to conduct these assessments. And while it's kind of a bit early to start sharing what we're learning from these assessments, since they're really at the start of the process, we're already seeing some common themes that are emerging around the types of support needs the organizations have. And some of these are things like strategic planning, long-term sustainability, and domestic resource mobilization. Okay, so with that, I come to the end of what we had prepared for sharing with you in terms of the capacity development work we're doing under Momentum with MNH organizations. So I'll pause there and open up for questions to the panel. Holly and others, I'm not sure if you're able to see the chat, but since I'm sharing my screen, I can't.
Yes, we do have a question from Nita is asking, is there a midterm assessment to see the progress on change action plans?
Yeah, so the change action plan monitoring kind of works in a way that is really sort of set in conjunction with the partner. And what we usually recommend is sort of a quarterly monitoring to sort of see where actions are on the change action plan are, what we need to adjust, and so on. But there are cases like, for example, with the CRMA, where we are planning to do a more frequent monitoring of even monthly or bi-monthly, so that we're kind of in touch with the organization very closely as they go through the change action plan actions.
Great, and we have another question that is, will this lead to the graduation of those organizations?
Again, this is like, definitely a goal that we have in the process. And I'm not sure I mentioned this in the presentation earlier, but all of these standards that, we've developed, especially the ones on the organizational side, are aligned to the USAID NUPAS. So in doing sort of this assessment, the organizations can also get a NUPA score, which is sort of the basis of graduation. And we really sort of assess this at the beginning with the partner if that is part of their ambition, and ensure that we have kind of actions and activities in the change action plan that would enable that. And that may not always, like depending on where the organization is, it may not fit in within like the year and a half timeline that we have, but definitely kind of tailor actions and provide a roadmap that helps them reach that goal.
Wonderful. And then someone sent me directly a question. What are the different types of questions that are asked in the different modules of the assessment?
Yeah, so like I mentioned, kind of, we're not asking, I guess, questions specifically in the modules themselves. So let me maybe go back to this slide. So essentially, like all of these are statements, or what we call statements of excellence that the organizations score. But prior to kind of doing what, prior to doing the scoring, what we are having are facilitated discussions and activities that, talk about some of these areas. So we're not kind of directly asking these questions, but the questions are focused around, for example, if it was for, let's say, sustainability, we would kind of ask questions around the plans that they have, what some of their sources of funding may have been, what their vision and goals are moving forward, which really sort of sparks conversation between themselves to understand kind of where the organization is at with that area. And once they've kind of had that discussion, and a lot of times, we also see that everyone may not be on the same page in the organization about a number of things, especially because it's a cross-section of people. So this discussion sort of helps in getting that aligned understanding that then provides a basis for them to be able to kind of score against the areas and understand where the organization is at.
Great, thanks. A couple of other questions. Sorry, just trying to wade through these. Can you share a little bit more about the linkage between momentum and Align MNH? Jim, maybe do you want to take that one?
Okay, yeah, sure. Well, I think there's sort of a grand coalition, so to speak, that Align definitely is trying to form, between countries and the country and the overall leadership, WHO, and others. And momentum is definitely within that sphere, so to speak. We definitely share our plans with each other and try to make sure that we can complement each other to the extent possible within different countries. So that's, I mean, in a general sense. I don't know if any.
I can also add just a little bit to that, but Momentum's role through Momentum Country and Global Leadership is to engage with the various national maternal newborn health technical working groups, as well as country stakeholders, in order to assist in planning and course correcting and driving action that's powered by data. We also are helping to facilitate various opportunities for multi-directional learning and making sure of sharing of evidence and different experiences, and working in partnership to prioritize the ways in which we're addressing various obstacles and gaps that are keeping us from reaching MNH goals and milestones. So I'm sorry that I see a lot of other questions are coming in too. I think a question for you, Kavya. is so this is a sort of self-assessment for capacity development, or excuse me, this is a sort of self-assessment for capacity level. How has that generally been going? Is there sometimes a disagreement about capacity levels?
Yeah, no, it's definitely like a self-assessment, and we are kind of a little early in the process, so I can kind of share with you examples just of the few workshops that we've had or are planning. But essentially, because this is a scoring sheet that a number of individuals who are participating, like all of the individuals who are participating in the ITOCA get to fill in. It's not like they need to kind of agree on one score, because agreed, like that would definitely like lead to kind of some disagreement, and then how do you sort of decide which is the score you want to agree on. So the purpose of the discussion is to really for them to be able to talk about these things as a group, and then they do this individual scoring, which which is sort of done separately. And when we have when we share back the results, we share like a median score as well as a consensus score. So the median is more like an average to see where the group landed. And then the consensus score is more like a standard deviation to see sort of, what kind of percentage of the group agreed with that score versus not. So there is like some nuance over there. And again, then, this assessment sort of serves a second purpose of, kind of deciding what type of action they may or may not want to take based on these scores.
Great. And what role do ministries of health play in the process? And do you have to align to specific requests that are coming from them in different countries?
Jim, do you want to take that? I think it may be a broader question, or is this specifically for the ITOCA?
Yeah, this is a good question. Actually, it does get at another question that Claudia Morrissey also had about, which I was starting to tap away in the chat about, but I can maybe just kind of take both of these questions together and just give a little bit of an idea. So we work within a ministry-led coalition, or a consortium, wherever we're working. Of course, we're working, we're funded either through USAID Washington or through the mission, or both. Wherever we're working, and we're always tasked with working with the Ministry of Health in the lead. That said, though, and given the priorities that they have, and kind of trying to co-create with them, that said, though, we're looking also always to kind of expand the partnership, and the kinds of organizations then we would be looking to kind of make sure, that already have relationships with the ministry, but that we think can complement them well, are those that we think are going to be able to have a great chance for sustained action at scale. Even when I say a great chance, there are still organizational and capacity, weaknesses that they have, and those are the ones that we want to address. But the kinds of organizations they're working with don't tend to be, there are some that are kind of small faith-based, community-based organizations that are working in specific areas, but we're much more interested in those that are working at larger scale. They might have very many roots in the community, but they're working in many places. So faith-based organizations all over Africa, the Christian health associations, things of that nature. Those who are educational institutions, those are professional organizations, others of, as Kavya already talked about, the Caribbean Regional Association of Midwives is one that we're working with. So ones that can complement the ministry and also, work at relatively large scale. There are some other things we do that are working in specific areas with CBOs, FBOs, et cetera, but that's, not as much a focus for some of the larger scale programming that we hope will have the ability to kind of be sustained at a large scale after the ends of project support.
Great, thanks, Jim. Another question. Have some organizations increased their score in M&H, but did the organizational capacity indicators and vice versa? And how do you deal with misalignment?
So I think I'll be better positioned to answer this question once we have done like a second round of the assessments for the M&H organizations. Like I mentioned, we're just in the very, very beginning stages, and we've kind of been through the process with the CRMA, and we'll kind of have a reassessment done next year to sort of understand like how they have changed in these indicators. I don't know if I got the last part of the question, Holly, about something about misalignment, and I can try to answer that.
Yeah, I think the person meant, or Joy, if you want to maybe elaborate your question a little bit more.
Sure.
Were we able to address that? Or you can go ahead, sure.
Yeah, can you hear me?
Yes,
yep.
We can hear you clearly.
Hi, so sorry, it was a typo there. So let's say that their scores in the M&H indicators increased, but the organizational capacity indicators are pretty stagnant. Mm-hmm. So then there's kind of a misalignment between maybe that area and the other areas. So how do you kind of bridge that gap when you see those gaps? Do you then give more technical assistance to the organizational indicators, or how do you work on that?
Yeah, so I think like ultimately what goes into the change action plan is, at the discretion of the organization, but we definitely like provide all of this data and evidence and kind of summary from the discussions to sort of nudge them in the areas that clearly have these gaps. I think in that situation where we are seeing that for say for a technical area, if the scores are going up, but there's still some challenges in the organizational side, we would definitely kind of have that as a discussion, like not just at the reassessment, but even in when we're doing like the change action plan monitoring, because I would think that if the scores are low or sort of have remained stagnant, there's been indication of that in sort of the initial assessment and discussions as well. And I think, just kind of going with the experience of the few organizations that we've worked with so far, there's actually a lot of enthusiasm to sort of work on those organizational areas, since, it's a cross-section of people who come to this workshop. So it's not just, for example, the program staff, but then also staff from these different organizational areas that have a say and voice at the table to kind of push for the types of actions they want to be taking in those areas.
Great, and we have another question from Luna. Can you elaborate on the coaching and mentoring strategies and the activities to achieve improvements in practices, process, and scoring?
Sure. So I think, again, this, we haven't reached the stage where we are doing these activities specifically in Momentum just now, but, to give you an overview, depending on kind of what the action that's outlined in the change action plan. So for example, if it's to, do a strategy for strategic planning, we'd kind of look at our toolkit of approaches and see which one applies. So for example, in this training, coaching and mentoring one, we'd have a discussion with the organization to, see if like they already have in mind kind of individuals or groups that are outside of the organization that, specialize in doing this sort of facilitation or provision that they want to kind of bring in, and, how Momentum could support with that. So one is kind of for them to see like internally what they may have, as well as in their specific regions. And then, if that's an action that they see which is like more suited for external assistance, so something that Momentum partners could provide, we then kind of see if we have any existing trainings on this that that PACT has kind of done courses on, which could speak to the area that they are looking to develop, or secondly, then kind of see if there are any specialized coaches or mentors, if it's say a technical area that we could put them in touch with to sort of provide support on that specific action.
Thanks, Kavya. Another question is, what is the difference between the Caribbean and the regular ITOCA tool?
So I guess like the regular ITOCA tool is, this universe of kind of all of the organizational as well as technical areas. And the way that the Caribbean Regional Midwives Association customized it for themselves sort of gives them the output of the tool that they want to use. So for example, in the organizational areas, they kept all of the ones that we see here on the left side, but tailored some of the specific indicators or statements. So for example, like under financial management, there were several indicators that were talking about payroll systems, for example. And because they are a professional association that's like run with volunteer members, a lot of those statements didn't apply. So, it didn't make sense for them to score themselves against that. So the version that we had for them essentially was a pared down version of the ITOCA tool with kind of the indicators and statements that were most relevant to the CRMA. Then on the technical side, even, for example, like the maternal and neonatal health tab, a number of those indicators they felt were focused more towards, say like a civil society organization that's working directly as an NGO within communities, but they had a very specific role of a, professional organization of other regional professional organizations. And, in that they had like very specific goals and objectives set for themselves. So what we did was we developed sort of standards and indicators that were aligned to those goals and objectives that, they then used to score for themselves. So there are like some subtle differences kind of looking between like the bigger ITOCA tool and then what ultimately the organization wants to customize and use for their own scoring.
Thanks, Kavya. I don't see any other questions in the chat right now, but just want to give folks a chance to unmute yourself. Feel free to take yourself off mute or turn on your video and ask a question to Kavya and Jim. We're happy to take any outstanding questions.
Yeah, I'm just going to stop sharing my screen so I can see the rest of the people and make this feel like a networking session versus just a one-way presentation.
Well, I will give folks a few more minutes to think of any outstanding questions. Oh, one did just roll in. Will we have access to this tool, Kavya?
Yes, yeah, we are, we are waiting on, some approvals to come in, and then this will be posted on the Momentum website, I believe. And we are also available to kind of talk through any specific aspects or facilitation or sort of, how just the use side of things.
I've also just gone ahead and posted a link to the Momentum website where folks can learn a little bit more about the entire suite of Momentum Awards. And then to learn more specifically about Momentum Country and Global Leadership, I'm gonna go ahead and drop in a link to our project fact sheet there where you can learn a little bit more about our approach. So I think Jim and Kavya and I will stay on here for a few more minutes if folks do want to come on and chat. But otherwise, I think that's what we had planned to share with you all today. And I'm glad we were able to address a lot of your great questions about the ITOCA tool and just our approach to organizational capacity development in general. And I think with that, we will go ahead and wrap things up. But like I said, we'll hang around here for a few more minutes. If anyone does want to stay on and chat, can continue to chat for a couple extra minutes. Thanks so much.
I see a question in the chat, which I can answer. Hi, has this work been done for any private for-profit organizations? So currently in Momentum, no, but this approach has been used with private sector organizations in the past. I was not involved at the time, so I'm unfortunately not able to speak more to that.
Okay, thank you. Can I ask you a question directly? Yeah.
Sure.
Yeah, but you, I don't know if you heard of the experience with private for-profit, or if you have any thoughts about how it can work with private for-profit organizations.
Sure. So I can always kind of circle back with my colleagues to kind of talk, share with you more specific experience about how it's worked with private for-profit organizations. But in terms of the approach itself, it's it's essentially like something that can be easily tailored for any type of group, really. So while we kind of speak about this for the nonprofit or CSO sector, we can essentially be developing statements that are applicable to private sector organizations, and then also like look at specific areas that they are working in. So I think it's a matter of co-creation in this regard, and sort of seeing like what the interest is from the groups, but essentially like it would still work in a similar way in terms of doing a self-assessment, understanding what the gaps and needs are, doing some action planning around it, and then providing support to plug those gaps. So yeah, I mean, I think like in terms of the process, it remains the same, but there would be specific ways that we would tailor it for private organizations after kind of an initial conversation with them. And similarly, we also do this with government entities, for example, where we customize this to really like their needs. So for example, like they may already have different standards like within the agency or within the government that they need to align to. So in that case, we would use those standards for the assessments. In a lot of cases, they, for example, may not have the kind of time to like spend 3 days in a workshop like this. So, we would look at a more virtual, hybrid or shortened approach to see sort of what allows for maximum participation. So yeah, I mean, I think similarly, we would keep in mind like what specific customizations would make sense for the private partner and do this type of approach with them should they be interested.
Thanks. Are you going to share your slides later?
I can. Holly, do you?
Yeah, so all
posted somewhere?
Of course, yes. So all of the materials from both the formal agenda of the forum as well as the networking session will be shared on the Knowledge Hub. So I'll just go ahead and drop it's alignmh.org.
Yeah.
And all meeting resources will be shared there. So you'll be able to access the slides. And I believe Kavya mentioned that the tool will, when we're done, it will be posted on the Momentum website, which I shared a little bit further up in the chat.
Okay, excellent, thank you.
Yeah, thank you.
Thank you, Kavya.
Thank you for your question. Right, we'll take that as our cue. Thank you everyone for joining. My email is in the chat and look forward to continuing this conversation offline. Goodbye.
Great. Thanks so much, Jim and Kavya. Everyone take care.
Thank you.